Another individual is an oncology navigator who specializes in breast cancer and preferably specializes in advanced breast cancer. This is someone that's going to be their touchstone, going to be their patient advocate. Most of these individuals are registered nurses, nurse navigators, and they're going to be walking alongside the patient from the point of diagnosis all the way through, literally to end of life. They serve as the hub for the team so that when the patient has a question and they're not sure who to go to, the navigator is that source and she can get the information that the patient needs rather than having to chase it down herself. She also is responsible for patient education, psychosocial support, identification of barriers to care and barriers to treatment. The most common barrier in the United States is lack of transportation. The patient may take a bus to work, but that bus doesn't go to the place where she gets her chemotherapy, for example. And navigators have access to wonderful resources locally, regionally, and nationally to undo these barriers, such as taxi vouchers, or the hospital has a contract with Uber so that the patient can get free Uber rides, for example. She also is very well trained in culture and ethnicity differences so that she can be respectful of the patient and where they're coming from. She also has access to interpreters if there's a language barrier. She provides patient education information that usually is at a 5th grade level. And as a patient advocate, she really does get to know that patient well because she is with that patient so much and is that touchstone. So this is someone that the patient oftentimes will confide in and will express what her concerns are, what her worries are. So again, that navigator can help with providing necessary resources. They also have, which is fabulous, financial resources, which is a huge barrier to care. Financial resources for copays and deductibles, for being able to have drug companies provide discounted, very deep discounted drugs so that the patient isn't paying much money out of pocket at all. There are also patient advocacy organizations that the navigator knows about that will help cover the mortgage of a patient, that will help cover gas and electric bills while the patient is getting her treatment. So we oftentimes don't realize that these resources exist until we need them. And the navigator does periodic barrier assessments in talking with the patient and say, let's just review, do you have any current barriers right now that I need to address for you and take care of for you? Childcare, for example, can be a barrier for a patient coming in and getting the treatment that they need.